So why, if you're only missing one tooth, why would you want to get a dental implant?
So in traditional dentistry, the option that we used to defer to is doing like a bridge over the area where you're missing a tooth. And the disadvantage of the bridge is we actually had to carve down or reshape the teeth adjacent to the gap. And those could have been perfectly healthy, good teeth that we were just using as anchors or support for this bridge. But now with dental implants, and the other thing about the bridge is, those maybe last, 10 years, 12 years, but if we want a more permanent solution that's gonna be less expensive in the long run, it would be a dental implant. We can leave those two other teeth alone. We don't have to touch those teeth. We can just exclusively work in that area where the person is missing the tooth, and it's literally like getting their tooth back.
Is that right? And they can eat whatever they want?
They can eat
How
whatever
soon can they eat?
They can literally eat once we finally deliver the final crown. They can floss around it just like they would any other tooth. There's no special maintenance to it.
Now what about expense?
Expense-wise, long-term, it's gonna be less to do an implant in the present than doing a bridge in the long term. Because if you have to do a bridge and then something happens to one of those teeth, maybe you need a root canal now on one of those teeth, maybe the bridge has to be redone, then you're doubling the expense over time. Still, an implant would be cheaper.
So implant's like getting your tooth back.
Exactly.
And they can last for how long?
They can last for,
So if in your 40s you could have it forever?
Oh, for your life, yeah, I would say, for sure.
So how old can you be to get dental implants?
Yeah, so our oldest patient has probably been in their 90s who's gotten, age isn't really the issue. And studies have shown, people up into their 90s could receive dental implants.
What about pain? It seems painful.
It's actually not. Again, with oral sedation, with 3D cone beam technology, we're able to place these implants more efficiently, more effectively to alleviate that post-op pain. And again, there's this image that it's just this huge surgery, this big procedure, which it is, but the recovery time is minimal, and the result is, again, amazing in the end.